Dr. John Torres here, Dr. John with NBC. On this Facebook Live, I want to go over some headlines you've probably heard over the past few days, particularly headlines that you might have had some interest in but don't have a full understanding, and get behind those headlines to give you a better understanding and hopefully let you walk away with some information that you can use to get through this pandemic sooner rather than later and in as healthy a fashion as possible, not just for you, but for your family, your loved ones, and the community in general. And then once I get through those headlines, go ahead and answer questions you might have. So if you have questions, please send them our way so I can get to as many of those as possible. But first, let's start with the headlines. First and foremost, I think everybody understands that we're in the midst of a huge upswing in coronavirus cases right now. If you've noticed over the past few days, the numbers have continually risen. Back in summertime, we were talking to some experts, including Dr. Fauci, who said at some point we're going to reach 100,000 cases a day. Well, we went right past that, completely shot past 100,000 cases. Now we're looking at over 150,000 cases a day. As a matter of fact, yesterday was in the 160,000 range of people. And some experts, Dr. Jha being one of them, who's out of Harvard, is saying we could be looking at 300,000 cases a day. And so we have to be very careful. And the reason they're all saying that is because we knew cases would start rising once we started getting into our colder months, because we tend to group indoors. We tend to not go outside as much, which we know is better for controlling the spread of coronavirus. But also the virus likes colder weather, and we also tend to have runny noses, coughs, sneezes, those types of things, which is why these viruses, respiratory ones in particular, like coronavirus, like the flu, spread more in cold months. But guess what? We haven't even really hit our winter months yet. On top of that, we're coming into our holiday season. As one expert put it, we're coming into the darkest period of the pandemic. There's 6 weeks here between Thanksgiving and New Year's where people are going to start gathering, people are going to start getting together, and we're going to see even bigger spikes in cases. So unless we start getting this under control, we're going to see these numbers rise continuously, and that's going to mean more measures taken to try and keep it under control, more shutdowns, much like we're seeing in Europe, where they're targeting a lot of areas with different shutdowns and trying to get it under control. Something that could happen here as well, but assuming if we can get our human behavior under control, we can start doing more of that masking, that social distancing, and making sure we wash our hands and open windows to ventilate things, we can get these numbers down. But the big concern is what's going to happen over Thanksgiving weekend. Thanksgiving is less than 2 weeks away right now, guys. And so a lot of people are talking about getting together. A lot of different experts, a lot of different politicians, governors in particular, have said not to do that. Don't have get-togethers with anyone outside your immediate family. But the realism is, realistically, people are going to get together because this is a time period, a holiday, where people do get together traditionally. And we've been in this pandemic for 10 months now, and people are tired of the pandemic. They have pandemic fatigue. They're tired of wearing masks. They're tired of social distancing. And they're particularly tired of not being around family, friends, and loved ones. And so this holiday season, I think most are expecting realistically that people will get together. There are ways you can do that safely. And one way, looking at schools is extremely important. And I had a couple of conversations today with some experts on school safety when it comes to coronavirus and what should be done going forward here. And they had some interesting thoughts. Number one, if there's a huge outbreak in the community, then you need to worry a little more about the schools. But schools themselves are much, much safer than other areas and other parts of the community. And we have found that out, especially smaller schools, the elementary schools tend to be extremely safe. It's not completely safe, but we're not seeing much transmission. We're not seeing many complications from that, both among the staff and the school children. We are seeing a few, but not many. So we do know that in-person schooling can be safe as long as the community itself doesn't have huge hot spots and large numbers of coronavirus spreading around the community. Once that happens, though, you have to worry about the school itself even more so. And what one expert recommended, which he's Dr. Rubin out of what's called CHOP, the Children's Hospital of Philadelphia, just finished talking with him about half an hour ago. And what he said I thought was pretty interesting. He said that what he is recommending is that people starting Monday, which is just a few days from now, past the weekend, is that people switch to virtual school through New Year's Eve and then go back to school when school opens up after New Year's Eve once 2021 takes over. And the reason he's saying that is because right now we are getting to that time period again, the holiday season, where we're going to see huge rises in numbers. You want to make sure that your children going up into that period, again, he's talking about Monday, so it's about a 10-day period before Thanksgiving, that they've been as protected as possible and do that virtual learning. Now, he's not saying school should close down. He's not saying this is a permanent measure. What he's saying is start looking at things in about 3-week increments and start looking at it here from again, Monday through Thanksgiving, and then start looking Thanksgiving through New Year's, looking at those time periods of keeping school virtual so you can get children out of that environment, particularly, shutting down sports for that limited time period to make sure that these children are safe, because if we can keep the children safe, well, number one, we're keeping them safe, but we're also keeping the spread down that might be happening, because again, they might have it, and we do know that children can have it and be not symptomatic and can spread it that way as well. So things to think about and things to be basically putting into your thought processes and your planning as you're going forward. If you have the opportunity, and he acknowledged not everybody has the opportunity to be able to do that, to switch virtually, but if you do, that's one way you can increase the safety measures going into the holiday season. So something certainly to think about. Now, the other thing we've heard about, the other headline has been the vaccines that have been in the headlines over the past week or so. Pfizer first came out and they said, okay, we have gotten our trial, we've gotten some information partway through our phase 3 trial. We went ahead and started looking at the data because we got the number of people we wanted to look at the data, and we're finding out that the people we're looking at, and again, these are all preliminary results, showing about a 90% efficacy rate. So in other words, it's about 90% protective from getting coronavirus. If you remember a few months ago, a lot of the experts I was talking to were saying they're hoping for 50 to 70%, 70 being the high end, going, boy, if we can get 70%, we're doing pretty well. Well, now we're talking 90%. And experts I'm talking to are saying, that 90%, there's no reason to think that's not happening in other areas as well with other vaccines that are being produced for coronavirus. And so this is giving us a lot of good information and a lot of good news. But at the same time, remember, it's preliminary. Now, you might have heard about the Russian vaccine, which showed 92% efficacy. Well, the difference there is the Pfizer vaccine was done on 90 plus patients, and they're continuing to get more information. The Russian vaccine was done on 20 patients, and so it's very, very early information. So it's looking good, but it's still extremely early, as is the Pfizer one. These are all preliminary endpoints or preliminary results we're getting. And so time will tell as the phase 3 gets done as to how effective it is and how safe it is. But in what they're seeing now in the early part of phase 3, it's looking safe, it's looking effective, and it's looking like it's something that can certainly help us get through the pandemic. But as I say, no matter how effective a vaccine is, it's only as effective as the people who are getting it. So if enough people get it, then we can get herd immunity up, then we can get this pandemic under control. If not, that won't happen. And there's a huge movement of vaccine hesitancy around the country for a variety of reasons. And trust in the vaccine is a big issue right now. And as a matter of fact, I was talking to Dr. Paul Offit. He is a vaccinologist, he's an infectious disease doctor, and he is actually on what's called ACIP, which is the Advisory Committee on Immunization Practices. That ACIP is the advisory committee that advises the FDA on whether they should approve a vaccine. He's also on another committee called COVAT, which is the Coronavirus Vaccine Analysis Team. COVAT was formed because they knew that people weren't necessarily trusting what the FDA was saying. He's saying you can trust the FDA because of some things that have changed recently, but at the same time he understands that people might not. So they form this other committee that he's on so they can go ahead and give private information outside the government sources to people as to how good the vaccines are going to be going forward. But the question I had for him, the information they can give us is only as good as the information they get, meaning transparency is a huge issue, especially when it comes to vaccine trust, and they're being able to tell us, yes, the vaccine is safe, the vaccine is effective, go ahead and get it. And what he told me was kind of interesting. He said, point blank, that ACIP, again, the Advisory Committee on Immunization Practices, who advises the FDA on whether to approve a vaccine or not. This is a committee the FDA put together of private individuals, experts. So ACIP will advise the FDA on what to do. And he told me that essentially ACIP will not approve this vaccine unless they get all the information they need, unless it's transparent. And once they get the information, then that information becomes open source, so then all these other committees can do it as well. They can look at that same information and they can give information on what's going on and how they feel about it. So he said a couple things. One, you're going to see some of these groups like COVAT. There's some other groups out there as well, getting the same information that ACIP has and getting that information out to the public. And so you can look at these other sources that you trust more and say, okay, I think this is going to work. I think this vaccine is safe and effective. And the hope is that builds trust in the vaccine so more people can get it. But the question I had for him is, there are so many different groups and organizations out there right now that are looking at setting up their own committees to determine the safety of the vaccine. Right now, there are around 5 states that are looking at setting up their own committees so they can give their residents information on what they think about the safety and effectiveness of the vaccine. There's medical groups that are setting up to give information out to the public about the vaccine safety. And of course, then there's ACIP and the FDA themselves doing a similar thing. So is it going to get so confusing that people are going to get different messages? And he was concerned about that. And he said, yeah, that is something that could possibly happen. And so you want to look at the bigger groups. You want to look at the groups you trust. And set that down right now. Start looking at the groups to see what the compositions are and who you trust. So when that information comes out, then you can look at that group and say, what do you think? Now, hopefully it's not a mixed message that gets people confused, because we've had that in the past with other things, and we know that doesn't work very well. And hopefully it's a unified message that says, yes, it's safe, or it's this safe for these types of people. And so my guess is by the end of this year, beginning of next year, you'll start seeing a vaccine go for emergency use authorization. So probably in the early part of next year, you'll start seeing it getting distributed. And once it gets distributed, it'll be distributed in phases. And then general population, probably April timeframe, before most of us can get the vaccine. But hopefully we do, because it's not the only thing that's going to end the pandemic, but it's one of the main things that this can help end the pandemic. And then the last bit of news I want to talk about is there is some information out about, to answer the question that a lot of us have had since the beginning of the pandemic. Why do some people get sick with it? Why do some people die from coronavirus? And why do other people either not get symptoms or barely get a cough? And up until now, we weren't really sure. And there's one reason behind it, we think. And again, this is only one reason. There could be many, many more reasons. But it turns out that some people have the genetic predisposition. In other words, their genes are set up to have them produce an antibody. That antibody, which they're calling an autoantibody, because it attacks the system. So it's an autoantibody that's attacking a person's own body, own immune system. And what it does is when it attacks the immune system, it is attacking this one protein called an interferon. Now, what interferons are is they're essentially an early warning system for the immune system. So they look out, they see the virus is coming, they send out the alarm saying this virus is here, immune system needs to start activating, and that's when the immune system starts jumping to the forefront and start fighting the virus. When this virus is there, there's other mechanisms for it being notified too, but if it's not notified early enough, then it has a harder time fighting off the infection. So, again, people with this gene produce this antibody, this autoantibody, that doesn't let interferon do its job. And so the interferon cannot tell the immune system to go ahead and start attacking this. It turns out in the study they looked at about 1,000 people, about 10% of them had this. And the 10%, these are people with pneumonia, people that are critically ill. The other thing they found out was interesting, it affects more men than women as far as being hospitalized, being in the intensive care unit, being critically ill, and unfortunately dying from coronavirus. Didn't affect as many women as men, but women with this gene ended up having these long haul symptoms we're talking about, where they end up recovering from coronavirus but having prolonged symptoms for months on end. And so I think the big message for all of us is we're getting a better understanding of the virus. We're getting a better understanding of why a 30-year-old might end up in the hospital, in the ICU, and possibly even dying from coronavirus, whereas an 80-year-old, who we put in a high-risk category, might just get a slight cough and be okay. It could be this gene that they have. And they're working out what to do with that at this point and what it can mean to us at the regular level, where we might want to know if we have that gene and what we need to do. But the bottom line is, don't rely on that, because just because you have that gene doesn't mean you're going to get sick from coronavirus or die from it. Just because you don't have it doesn't mean you're not going to get sick or not die from it, because there could be other genes at play as well. And so we all still need to be careful. But it's certainly giving us more information and a better understanding of the virus as time goes on. And like I say all the time, we're learning more about this virus every single day. And this is one more thing we can add into that bucket. But again, looking at the headlines, number one, the numbers are going up. They're skyrocketing. Number two, and on top of that, looking at schools in the holiday season and what to do there is going to be important. Number two, the vaccine is showing some good effectiveness, but at the same time, these are preliminary data points, and we need to wait to get more information. But we also need to understand that transparency is hopefully going to be there, and there's a variety of groups, including ACIP, which is the Advisory Committee on Immunization Practices, where one of the members told me personally that, hey, we're going to make sure that we have all the information we need, and until we have that information and we can digest it appropriately, we're not going to talk about getting FDA approval at this point. And then why some people get sick. Some people unfortunately die from coronavirus and others don't. It could be this gene, among other things, but this is at least a step in the right direction of understanding more about the virus. Let me see if you have any questions.
Is the COVID-19 vaccine made with a live virus?
Is the COVID-19 vaccine made with a live virus? No, there's a variety of different ones. There's two main techniques. One is an mRNA technique that they're using, and that's the Pfizer vaccine. And what that does is that puts mRNA, which is one of the encoders of genes in our body, into our body, and then our bodies produce the protein it needs, the antigen it needs in order to stimulate our immune system, and then our immune system is able to fight it off. The other ones use what are called an adenovirus, which is a virus that causes the common cold, and they take that virus, they essentially deaden it, but then they put in some genetic material that can make it act like coronavirus and put it into the body, so it's not a virus that can grow in your body at all. What they're doing instead is putting information in your body that can have your body create these antigens, which can then stimulate your immune system to develop what they need to fight off, the antibodies to fight off the coronavirus itself. So no, there is no live virus involved in this.
Is it possible that we will have a second nationwide shutdown?
Is it possible to have a second nationwide shutdown? It definitely is possible. And right now, again, we're heading up into a high category, 150 plus 160,000 people a day being diagnosed with coronavirus. And I know the constant thing I hear is that, well, we're testing more, so we're seeing more. Yes, we are testing more, so we are seeing higher numbers, but we're also having higher hospitalization rates. We're having higher number of people in the ICU. We're having higher positivity rates. So even though we're testing more, we're finding out more positive people. And those increases have nothing to do with the number of tests we're doing. And on top of that, we're probably going to start seeing more deaths as well, unfortunately, because the numbers do crop up. Although we are finding out that not as many people are dying now as they did back March, April timeframe, and we're not exactly sure why, but part of it has to do with the population that's being hit. Right now it's younger adults, back then it was older adults, and nursing homes in particular, the more vulnerable, so that could have something to do, or a big amount to do with it.
Doesn't a certain blood type also protect from COVID-19 complications?
You know, there was information out a few months ago, about a month and a half ago, about different blood types and which blood types actually seem to protect you from coronavirus and which didn't. And the bottom line to all this, and I talked about it on NBC News, is that you can't rely on that. You can't use that as something to say, I have the type of blood that protects me, and so I'm fine, or I don't have the type of blood that protects me, and I'm just not going to do well if I get it, because, again, there's so many different variables here, including what we talked about, the genetic issue that can cause you to be more susceptible to it. But essentially what the study found is that if you have O blood, then you're more protected from coronavirus. If you have A blood, you're less protected. But these are small studies, and again, it's one of those things you can't rely on that for anything. It gives us more information about the virus itself, and we're learning more constantly, and so getting this information certainly helps add to our font of knowledge and helps with researchers, but for our own personal lives, shouldn't really have a big influence on what we do, because we all need to do the four things that I constantly talk about. And essentially it's wear a mask, watch your distance, wash your hands, and then windows. Open windows to ventilate, and especially need to think about those things in the week and a half or so getting towards Thanksgiving, because it's important that we all keep safe. So if you do start meeting together, which again is not advised, but if you do meet together for Thanksgiving, that you stay as safe as possible. So again, thank you very much. Those are fantastic questions. Briefly going over the headlines again. Number one, the numbers are skyrocketing, and we're seeing them going up across different areas. There is some experts are telling me that, hey, when it comes to schools, one thing you might want to consider is going virtual starting Monday, so that way the children have not been interacting with other children or staff members the 10 days before Thanksgiving weekend, and so that way you know that they're safe, which means you'll be safe as well. Number two, the vaccine, getting much more information on vaccine trust and transparency in the research is important, and the experts I've talked to have said they're pushing very hard to make sure that happens, including at the FDA level. And then number three, this information we found about this gene they discovered that actually makes people more susceptible to coronavirus. In the study, 10% of the people who were sick had this, and so again, it's not everybody that has it, and it's not the only gene that could cause issues with coronavirus. So regardless of what we're finding out, we all still need to do those four things I just talked about. But again, thank you very much. I hope you have a fabulous weekend. And as always, I hope you, your family, your loved ones, and your community stay as happy and as healthy as always.